Good morning, everybody. Welcome to Research Participant Voices webinar. We are just going to make sure that everyone can get into the platform, and then we'll be making a prompt start at 11:01 or 11:02 maximum. So we've got a lot of information to get through. Just like to say thank you to everybody that's joining us today. This is the first time that we have had a webinar for the Participant in Research Experience Survey results. So myself and my team are really excited to let you all know what we found this year and talk you through some of the results. And we have some excellent stakeholders with us today. So we are very lucky to hear from them about what they think about the results and how that fits across the wider landscape too. So buckle up, it's going to be fun. Okay, we're at about 146 participants at the moment. So as I said, we want to start quite promptly because we've got a lot of information to get through. My name is Dr. Angela Polanco. I am the Head of Public Partnerships at the NIHR Research Delivery Network Coordinating Centre, and I'm very pleased to be able to present the results to you today and also introduce some members of my team who will be taking you through some of the interesting findings. Next slide, please, Damien. Thank you. So the summary today, we're going to take you through what is PRES. So PRES is our Participant in Research Experience Survey, why we do it, what the results from 2024 and 2025 have shown us. We want to take you through the key recommendations and areas for development. And we also want to show you the national dashboard and what our stakeholders and our delivery organisations can see when they log into the national dashboard. And then we're going to have a Q&A session with our stakeholders just to ask them what they think about the results and how they think that the results are applicable to not only the Research Delivery Network, but also across the health and care research landscape. Next slide, please. So PRES, how did it start? So I was lucky enough that this was already in being delivered across most of the delivery organisations in the country when I arrived into post. It was started in 2015 by the Research Coordinating Centre. We are now the Research Delivery Network, so we've changed name, but the survey still remains, and it's gone from strength to strength over the years. It was created in response to a growing need to understand what participants taking part in research thought about their experience, so that we could really see how we can make things better for people when they're taking part in research, but also to see how can we make sure that we recruit effectively to studies and we make sure that people stay in their studies until the end. So we don't want people to leave halfway through if there's something that we could easily remedy across their journey. It was developed in collaboration with participants and public contributors and delivery organisations, so people on the ground that are actually delivering the survey, as well as people who have taken part in research. And it's under constant review, and we're always trying to think of new ways to make it more accessible and more inclusive. Why do we do PRES? It gives participants a voice. So when they're taking part in research, we want to give them a voice about how care is being delivered, how research is being explained to them, and also giving them the option to hear about the results from what they have taken part in. We want to identify quickly what's working well and share that across the board. And then we also want to make sure that we can put into place improvements and share with everybody the value of taking part in research. And we want to make sure that the NIHR is committed to inclusive and people-focused research. What does the impact do? So PRES helps us to rapidly put into place improvements on the ground, and it also helps us to benchmark what is happening in near real time across the research landscape, and it helps us to develop trust with our participants as well. So we really want to show you that when you tell us what your experience has been by taking part in research, that we've actually taken that away and thought about that, and we've put things into place to make things better. And we want to make sure that participants of the future, that they have a better and more valuable experience, that we're constantly improving what we do. And we also want that experience to be consistent across the research delivery network, so that wherever anybody goes to take part in research, that they can also have a positive experience. Next slide, please. So what we want to tell you about today, if you can just go back for me slightly. That's it, perfect. So what did we hear from 32,268 research volunteers? So what I'm going to do now is just take you through the series of results. So next slide, please. So 2024 to 2025 was a bit of an interesting year for the Research Delivery Network. We went through a massive organisational change. We went from 15 local clinical research networks to 12 regional research delivery networks. So that in turn affected the results that we were able to collect from PRES, and it made it a little bit difficult for us to compare results from what we were seeing from 2022, for example, to this year. But we have an excellent data and analytics team, and they were able to look at the results from what we were able to gather and then pull out some interesting trends. And despite the organisational transition, we were able to see that the response rates fell roughly in line with an average across 2022 to 2025 of 33,000. So we didn't see a big drop off. And what we want to do now is to make sure that we keep improving on those results, so that everybody who takes part in research has a voice and is able to share that with us. Interestingly, this year as well, we also saw a 40% increase in responses from children and young people, which is one of our target areas. So we were really, really pleased to see that the work that has gone into increasing engagement with children and young people has actually now started to show in the data. Next slide, please. So top level results, 91% of adult participants would consider taking part in research again. Now, this is really important to us because not only do we want to recruit people into research, we also want to make sure that next time that they're approached to take part in research, that they think about this positively and that they talk about this positively amongst their communities, amongst their friends and family, and that they are willing to take part in research again. So this is one of the key statistics that we hold dear to ourselves in the Research Delivery Network. 96% of adults and 95% of children felt that they were treated with kindness, courtesy, and respect by the research staff. And this is really a testament to the excellent staff that we have across the entire Research Delivery Network and also the NHS. We have amazing staff on the ground, and this really helps us to show that they are going above and beyond every single day to make sure that everybody receives the best care possible. 93% of adults felt that their contribution was valued by researchers. This is also important because we don't want people to feel that they are a number or a tick box. We want them to feel that they are treated as an individual when they are taking part in research. Next slide, please. So interestingly, 29% of adult participants in this year's survey said that they didn't receive enough updates during their participation journey. So this is one of the key things that we want to work on. It's no longer enough for us to say that we have good results about people wanting to take part in research again. We really want to make sure that every single part of the research journey is a positive one. So we want people to make sure that they know how to receive updates and how to communicate effectively with their study teams. 23% of adults and 20% of young people told us that they didn't know how to access the results of their study. We really want to explore this data and find out what would be the reasons behind this. Are there things that we can put into place that would rapidly solve this? That means that you would know how to access the results of your study. It might just be that the communication is not quite right and that we can just easily remedy this. So this is something that we're going to focus on over the next coming years. 17% of young people and 15% of adults told us it was not clear enough how to contact the study teams. Again, we want to make sure that this percentage is being addressed and that we are actively putting into place steps to address this. We want to make sure that participants know exactly how to contact their study teams and make sure that that process is accessible and inclusive. Next slide, please. So findings 2024-2025, a little bit more around the data. We have 54% of adult surveys that were completed online. This is really exciting to see because we have been putting into place measures so that the online journey is the preferred option, whilst also recognising that the paper option is also needed for inclusivity and accessibility purposes. This traditionally used to be a high response rate on paper, so it is really encouraging to see that people are moving along this journey with us. There's also a 3% increase in usage of online PRES from 51% in 2023 to 2024. So we are seeing from the data that the usage of online PRES is increasing again, which provides us with some reassurance that this is something that participants are generally in favour of, and they're working with us to make sure that we get it right. 69% of adults reported that taking part in research for the first time, this was then when they were taking part in our survey. So it shows us that we're still attracting feedback from people that are taking part in research for the very first time. It means that people are still wanting to take part in research. But also we still do want to hear from people who might not want to take part in research or who might drop out during the research journey, because that's also important to us to find out the reasons why somebody might not be keen to take part in a study. 66% of adults were aged over 55 years. This is a trend that we have seen since we've been running PRES, and we're also trying to look at this across the research portfolio to see, is this reflective of the research studies that were out there at the time, or is this a trend that maybe we need to say, well, how do we get more young people involved in research, or how do we make sure that this spread is more even? Next slide, please. Diversity and inclusion. So we are really proud that PRES is one of the only ways that we can tell what the diversity, the demographic profile of research participants is. So there's not another measure currently where we can say people taking part in research, we can't break that data down by demographics or socioeconomic measures. So within PRES, we're able to ask people certain demographic questions and we're able to report on that. And we've been collecting data now for a couple of years, which allows us to see what the spread is across the responses. And although we know that this is only a sample of the people that are taking part in research, and on this slide here, you can see what the responses are to the 2024-25 PRES in comparison to the UK census data. So you can roughly see that white ethnicity and Asian and Black and mixed and other, you can see the comparisons between what we've seen in PRES and the UK census data. So we still have a bit of work there across different populations, but we're actually quite proud that in the small sample that we've been able to collect, that roughly we are similar to the census data. Next slide, please. A spotlight on specialties of interest. So this is in relation to the study portfolio. So we can see that cancer studies account for the largest proportion of responses with 16.5%, and that's followed by generic health relevance. So that means studies that could be for healthy volunteers or things that fall under generic health conditions that we're not able to break down in any specific detail. Cardiovascular research represents 9.9, and then you can see the other categories that fall under this. And overall, it reflects a broad distribution across all major health conditions. So we're hearing from people taking part in studies that are that fall within the major health conditions that are affecting the population. Next slide, please. Digging a little bit deeper into the NIHR portfolio, we're able to see that the responses that we're getting are primarily from non-commercial studies. So again, this is an area that we want to explore and possibly increase our responses with commercial studies. And interestingly, on the left-hand side here, you can see that the response rate from commercial studies is actually about half of those that we hand out to people. So we want to see within commercial studies, people are handing out surveys to participants, but we're only getting about half back. What are the reasons behind that? Is there something that we can do to help the response rate to improve against commercial studies? And then by site type, we're able to break that down a little bit to say that we're receiving responses from trusts, GP sites, and this other category. We've got some work to do there to kind of break that down a little bit further to see where these responses are coming from, but also to encourage PRES delivery in wider healthcare settings. So we want to be able to make sure that we are aiming to achieve the Department of Health's move from delivering research in the hospital settings to the community settings. So equally, we want to be able to say that people can tell us about their research experience in those community settings as well. Next slide, please. So the key recommendations from the report this year, we want to address the decline in participant satisfaction due to communication issues. So this relates to finding out how to contact the study teams, finding out your results of your study that you've taken part in, and also generally kind of day-to-day communications that participants feel that they are valued as a participant, that they are contributing to a wider picture, and that they are thought of as an individual and as a holistic person along the research journey. So we really want to investigate the results that we have been seeing over the past couple of years to see what can we do in this space. Are we able to help our research delivery colleagues to put some measures into place, or is there something nationally that we could do that would really make a difference to these results? We want to be able to capture the feedback from those who don't want to take part in research again, or who drop out along the research journey. As I say, it is a choice for people to take part in research. People can absolutely say no. That is absolutely fine, and it will not affect any care that they are given. But we want to say, what made that decision right for you? What are the reasons why you wouldn't take part in research? And what along the research journey might have happened that meant that you couldn't take part? There might be things there that we can't change, but I think we don't have any data there to say effectively that we can't make a difference here. So we want to explore that in more detail. Number 3 is to fully embed the digital first approach to PRES. I'm going to go into a little bit more detail about what the digital first approach is in a little bit. But we want to make sure that we hear from a wider range of people taking part in research. Currently, we hear from about 33,000, but there's over 100,000 people or more that take part in research every single year. So we're only hearing from a small percentage of those people. And one of the ways that we intend to try and hear from more people is through completing digital PRES. We want to increase the participation rates of children and young people. We've made strides to do this, but we want to keep on with the momentum to increase the voice that children and young people have within PRES. And we want to also make sure that PRES is delivered at different time points within the study so that we're capturing participant voices as many times as possible, and so that when there are studies that might be run over 10 years, for example, that experience might be very different at the beginning and at the end of that study. So we want to make sure that we are capturing both ends of the scale. And also for all types of studies, PRES should be applicable to every study that's out there. There might be some kind of rare exceptions where it might not be appropriate, but we want study to be applicable to as many studies as possible. We want to offer timely access to PRES data, and we want to share this data far and wide so that everybody can see it, that everybody that is interested in having this data is able to access it. So one of the ways that we're doing this is by this webinar today, and we're still working on different ways of how we can share this data with our stakeholders. And we want to increase the use of PRES by commercial sponsors and studies. So when I showed you the graphs in comparison to non-commercial and commercial, we want to kind of level that up a little bit, just so we can make sure that all commercial studies have the opportunity to use PRES and that we're seeing a more varied response rate between the two. Next slide, please. So I'm just going to go into a little bit for Pres for All. So next slide, please. So digital pres I've mentioned. So we've been very proud over the past year that we have scaled up to all regions across England with the digital pres model. So this is an online option to take part in pres. When we first looked at this last year, there was lots of different regions using lots of different platforms, and it worked in different regions, but nationally we were not able to see that data in real time, and we weren't able to see trends and patterns. So what we've been doing over the past 12 months is making sure that all of the regions in England are onboarded onto this one singular platform, that we are encouraging participants to take part in PRES digitally as a first option. And then what we were able to do by doing that is see the data on a national level and also on a regional level in near real time, so that the study delivery teams can see very quickly, are there any issues, can we solve them, what else is happening in regions next to me as well. So we can give you some more information about digital pres because it's a very big project and endeavour, but I just wanted to kind of give a shout out to all of the regions that have helped us to do this over the past 12 months, because it's been quite a bit of hard work, but the overall picture should provide us with a lot more usable data and a lot more data that is able to be shared in real time. Next slide. Pres Site ID tool. So this is a new feature. So we are offering free site identification service for commercial sponsors. So this will be available on our national Pres dashboard, and it really gives us an opportunity to show what the site's capability and capacity to host research is by giving them a proxy measure of participant experience. So they can not only look at a site with regards to can they deliver my study and do they have the resources to deliver my study, but also they can look at the participant experience and say, this site actually, the participants who take part in research here have a really positive experience, and they're having really positive results from feeling that they are cared for by the research team. So we want that to be just as important as, do they have the resources and do they have the money to set up the research? So this is a new feature that we're rolling out. And next slide, please. So I'm going to pass over to my colleague Maureen, who's going to take you through the National Pres dashboard. So she's going to take you through some screens and show you exactly what you can see on this dashboard. So hand over to you, Maureen.
Thank you, Angela. Hi, everyone. I'll now be walking you through the PRES National Level Dashboard. This dashboard aims to bring together PRES data from all across England and shows all the public sheets that are available for you to view. Next slide, please. So when you first open the dashboard, this is the top screenshot can show you the landing homepage that shows all the public sheets that are that sit in the dashboard for you to view. The first sheet is the guidance, where you can see some details on key things, example, how key performance indicators are calculated, what granularity of data is presented, and so on. Next slide, please. So the next slide provides a national overview of PRES results with the functionality to filter data by financial year, reporting quarter, study, site, NHS trust, and so on. Next slide, please. For example, when you apply the reporting year filter to 24-25, you can see visualizations, visualize key statistics based on last year's data, including top positivity scores, breakdown responses by survey type, collection method, and other useful summaries. Next slide, please. Beyond the overview sheet, we've got basically regional data progress and regional data in focus also presented on the dashboard. Next slide, please. So next, we've got responses by questions split between adult and children and young person PRES, where you can see responses to each of the questions visualized in detail with all the options that are there to select as they are on the survey. Next slide, please. Next, we have a sheet with responses by questions, which is split between adult and young person, like I previously mentioned. But here you can see that because they're all based in containers, so if you select the children and young persons, the same visualization is going to now present children responses. So it's the same container with options to visualize adult or children PRES as you may want to look at data. Next slide, please. So we've also incorporated diversity data into the dashboard. You will find visualizations of respondents' age groups where hovering over a bar reveals the exact number of responses in that category. There are also breakdowns by ethnicity, sex at birth, gender, and these are all specific to adult PRES only, as that's where this information is collected. Another thing to note is that this sheet has a minimum response buffer implemented. That is, it will only visualize data if 10 or more responses were received, just to preserve participant anonymity. Next slide, please. Next, we've also got data on free text responses. This data is available to some of the users of the dashboard because access to the free text questions is limited. And just it's there for everyone. It's there for basically on the dashboard, but it's not available for everybody to view just to preserve anonymity. Next slide, please. So this is the dedicated sheet for site ID tool that Angela mentioned earlier. Just to give you a quick preview, the table on the sheet presents positivity scores for 3 key questions. For example, if you see a 90% positivity rate, that basically means that 90% of the participants that returned a press for that site reported a positive experience in that particular area. Next slide, please. Finally, at the very end, we've got a snapshot of legacy data from 2015 when the pilot was initially launched and through to 2019-20, just before the question set was finalized and the coordinating center began receiving response level data. Next slide, please. So that concludes the walkthrough, and thank you very much.
Thank you, Maureen. I just wanted to mention as well, I think that somebody raised a hand. Just at the end, we'll have an opportunity to submit any questions or request a full copy of the PRES report. It's only because we've only got an hour to present all of this to you today, but we really want to hear from you and we are really interested to get feedback and answer all of your questions. So please don't worry, we will make sure that we can hear from you all. Next slide, please, Damien. So some case studies, I wanted to share with you some of the impact that PRES has had. So I've taken just a few examples here from all of the amazing work that all of our colleagues have been doing across all of the regions. So the RDN developed a new training program based on some of the PRES feedback. So we found that there were some participants that reported that they were feeling uncomfortable sometimes and that they felt that staff could use more of a sensitive and inclusive language during study visits. So what we were able to do from that feedback is develop a training course that focused on improving inclusion, particularly around gender, sexuality, disability, and neurodiversity. And the staff were then able to consider research participants' individual needs as they were talking to them. And this helped to make sure that participants felt welcomed and valued. And that particular research site fed back to us that this really worked and that they definitely felt that participants were saying to them that they noticed the difference in their study visits. Nottingham University Hospitals NHS Trust, they shared with us an example where they collected 95 responses from children's PRES, which then directly influenced changes such as having interpreters available at appointments and making sure that they had a more child-friendly environment. So this is helping to make sure that when our young people take part in research, that they feel also that they're comfortable, that they are happy to take part in research, which might involve procedures which sometimes they're not used to. And then the lollipop study, so practical aspects of the participant experience were improved using PRES feedback, and the study teams were able to offer snacks. They made sure that they could put engaged or vacant signs on clinic doors, and this helped to improve privacy. And they also introduced pre-appointment phone calls and text messages so that people knew where they were going to. They were reminded about their appointments, which then helped to improve study retention and recruitment. Participants after these changes reported that they felt more informed and better supported. So this is just a few examples of how we have used PRES feedback to make things better on the ground for our participants. Next slide, please. So I'm really pleased today to welcome 3 of our stakeholders. So we have Neho from the Health Researchers. Sorry, I can't get my words out now. Health Research Association, who's Deputy Director of Policy and Partnerships. And we have Kathy Gies Ward, who is a research lead, embedding research team at NHS England. And then we have Dr. Esther Mikaka, who's NHS NIHR Director of Research Inclusion. I knew that I would mess that up, so I'm really sorry. But I have invited them all today to come and speak to us about the PRES report and also what they think about the results and how this data fits in with the wider health and research landscape. So I'm really pleased to hand over, first of all, to Esther, who's just going to take us through a couple of slides.
Thank you, Angela. And I wanted to start off by just saying congratulations to you and team for all of the work that has gone into this. The PRES demonstrates the importance of inclusion for participation. And I think more importantly, part of the NIHR's research inclusion strategy is around developing a robust evidence base for the work that we do. And this is a clear indication of how we are using a robust evidence base to develop the initiatives that we need to do in the NIHR to improve inclusion in participation of research. So I've talked about inclusion, and it is one of the 4 eyes of the NIHR. So DHSE and NIHR have prioritized inclusion, and it is one of our strategic focuses. And for us, you cannot have the impact you want through research without inclusion. So it's important that we are investing in the things that allow in the initiatives and the activities that allow for better collaboration with the public, better partnership with participants, and better understanding of how we can address and reduce the health and care inequalities that currently experience. For us, ultimately, we need health and care research to be representative, especially representative of those communities that remain underserved by health and care research. So next slide, please. I thought I should just acknowledge that, as Angela has said, that even though we don't have a lot of data from the PRES, and even though we have a lot of work to do, as Angela stated, we are really proud that we've got a sense of the demographic profile of those taking part in research from the PRES. So the PRES for us represents a proxy of the voices we are hearing, and it's important to hear these voices. But I think more importantly, it is setting the future for investment in this area, but for also working in partnership with some of the other strategic projects that DHSE and the NIHR are working on to improve visibility of those taking part in research. I have alluded on this slide to the rollout of the NHS Number project, and my next slide is now going to talk a little bit about that project and what we're doing there. But I want to say that before I start talking about that project, that the PRES sits comfortably next to the NHS pilot project, and is really helping us in terms of providing that baseline for us to interpret whatever data we generate as a result of the findings from the NHS Number project. So my next slide, please. So the NHS Edge pilot project is aimed at collecting and analyzing aggregate data and information about the age, sex, and location, and also the deprivation decile of people taking part in NIHR-funded health research. That is phase 1 of the project. My last slide will talk about the future stages of the NHS Edge pilot project. Ethnicity data will be collected in phase 2. So why are we collecting this data? It's important to state, and also I've already elaborated, that in order to reduce health inequalities, we need to understand the different symptoms, we need to understand the different needs of our demographics. And so for us to do that, we need to collect the data, and we need to analyze the data, and then make decisions about the prioritization of funding, but also how we better engage with the communities that need where there's high disease prevalence and high disease burden. So the findings that we're hoping that the findings from this will help us know where we prioritize our funding, where we prioritize investment, and ultimately will help DHSC direct the NIHR in terms of better decision making. I'm going to move quickly because I'm mindful of time. By monitoring participant demographic, NIHR will be able to understand the scale of inequalities in access to research, but also target improvement activities and measure its impacts. So part of the work we're doing through the NHS Edge pilot project is understand how we monitor and how we ensure that, you know, all of our activities are having the desired impact and the desired outcome. Next slide, please. So how would the pilot work? This image just shows us a quick flow chart of how things will work and how things are currently working, because we have sent out our request to NHS Trust, who are using Edge to complete, to opt into the pilot. So we have sent out information. NHS England matches the NHS numbers to a set of identifiers, including age, sex, and postcode, and it sends it to the NHS Research Delivery Network. And finally, the NHS Research Delivery Network uses the data to create a visual dashboard. I cannot confirm how, when, and how that data will be made available to the public, but once we have that, we can communicate it with you. I can now confirm that there are 60 trusts as we speak who have opted into the pilot. So, you know, we launched it almost a month ago now. So we're seeing a decent number of sign-ups from the trust, and we're really pleased with the progress on that project. Next slide, please. So how would the data be used? It will be aggregated data. We will be comparing between deprivation deciles for an area such as the RRDN. We will monitor the gender balance of recruitment into studies in particular disease areas, and we'll be comparing recruitment rates in rural and urban areas as well. NHS England will develop a private dashboard of aggregate data for beta testing. Next slide. I thought before we go, because since its launch, we've had several questions around other protected groups that need to be featured in this work. So I should say that the pilot phase includes age, sex, and socioeconomic status. It does not include ethnicity and disability. There is an ambition for us to collect the data, but we need to work with our NHS England colleagues to effectively collect the data, find a mechanism for collecting the data and then implementing that. So the next phase will be ethnicity data in phase 2, and then there are plans for how we scope disability and roll that into our timelines for implementation. Disability, as is noted there, is not held within the NHS records at the moment, but we are doing work to find ways of collecting that data, because it's important for us to collect and to be able to present disability data, given intersectionalities and multiple long-term conditions as well. I'll now hand back over to Angela. Or Angela, did you want me to hand over to Neho or Kathy?
Thank you so much, Esther. I think it's really important for us to see what the progress of the other projects, the NHS Edge project, how that sits alongside PRES. And as you say, we're intending that PRES data will be able to support that project as it's being rolled out, and we can also then compare what we're seeing in PRES with what we're seeing with this pilot. So we're getting a really good idea about who's taking part in research and also what their experience is when they're taking part in research. So really trying to hear from everybody and all voices. I'm really pleased now to hand over to Kathy Gies-Ward, who's just going to speak to us from an NHS England point of view.
Hello, thank you, Angela. Yes, lovely to be here today. Good morning, everybody. My name is Cathy Jays-Warden, Research Lead in the Embedding Research team at NHS England. So our role is not to do research, but rather to help the NHS be a better place for research to take place. And we do that through a number of ways, which is through increasing the diversity of research, which is why I'm here today, also increasing the scale and pace of research and providing system guidance and assurance. So I lead a programme called the Research Engagement Network Programme. It's in its 4th year of activity, and the purpose of this programme is to increase diversity in research participation. But we don't do that directly. We do this by essentially building up trust with people in communities that are underserved by research, that are typically underrepresented in research. So in the last year alone, we have engaged with 29,000 people from underserved communities. Some of these people, a lot of these people, in fact, don't engage with health services at all. So all credit to the teams on the ground who are doing this very complicated work. So what is the relationship between the work we do and PRES? For us, because although we do want to sort of see an increase in diversity in research participation, we don't particularly see that step. So PRES for us is sort of the natural sequence of events. So we keep a very close eye on PRES data each year when it's returned, in particular 2 questions. Sorry, I should have also said that the programme that I lead, the REN programme, is a collaboration between NHS England and Department of Health and Social Care. We both fund the programme. So yeah, PRES represents the next step along. The 2 questions that we particularly keep a close eye on and that we would like to see greater visibility of at sort of board levels in the NHS is the ones around, I think the number was 91% of people would consider taking part in research again, because this really represents people who've had a good experience. Excellent, obviously we want to see a good experience. And also we keep a close eye on the one about 23% didn't know how to access the results of the research they'd taken part in, and 29% said not enough updates, because these really represent good research practice. So we would love to see those numbers going up in future years. So yes, additionally, I think the experience of research itself, I mean, as a researcher, I would feel a lot of pride in being able to deliver research that people report a good experience of. So sort of at an individual professional level, I think that's really important. And that's why I've put up this quote here. This is from one of our workshop participants. They asked to remain anonymous, but we routinely collect these testimonials from the teams that we work with. Before REN, we rarely saw researchers trying to work with people with learning disabilities in a way that felt respectful and understandable. The workshops and toolkits helped show that our voices matter and the research doesn't have to be so confusing. It's made a difference. So this was someone who was engaged in research engagement rather than participating in a study, but it was all about how to best engage with people. And this is what we like to see. Yeah, big thanks to the PRES team and the data analytics team who sit behind this. As I say, we really appreciate this. Thank you.
Thank you, Cathy. And I think it is just testament to kind of the relationships that we've built over the past couple of years, that we really want to make sure that the research journey and the health care journey sits very closely together. So we want to make sure that our data also feeds into then how health and care is being delivered, and the experience of people there as well. So it's really important to us to keep really strong relationships with NHS England and also wider system partners. So I'm really pleased now to hand over to NIHR Yamazaki from Health Research Authority.
Hi everyone, and thank you very much for inviting me to be part of this panel. So I'm NIHR Yamazaki, I'm Deputy Director of Policy and Partnerships from the Health Research Authority. I'm hoping that most people will be familiar with NIHR, but just a quick recap. It's an independent arm's length body of the Department of Health and Social Care and part of the NHS family. We were set up in 2011 to protect and promote the interests of people taking part in research and the general public. And to do this, we make it easy to do research that people can trust. So that's our mission statement. We are a connector and enabler in the health and social care research system. We have a statutory duty to facilitate safe and ethical research to take place in the UK, coordinate and standardise regulatory approaches UK-wide, and to promote research transparency. And I'll touch on some of these now. We recently launched our 3-year strategy, and one of the 3 key objectives is to help reduce health inequalities by ensuring that health and social care research is done with and for everyone. And I'd really like to emphasize that bit on research done with and for everyone. And if we really want this to happen, there are many things we still need to do, but one of these is to make sure that people get the right experience when they take part in research. And that's why the findings from PRESS and how we act on them is so important for us. So what are the kind of things that we are doing to respond to the findings from this and previous PRESS? So on the left-hand side of this slide, you see this report. Because clinical research is for and about people, we carried out a project a little while ago and worked with members of the public and researchers to find out what good people-centered research should look like. And that found that given the right opportunities, many people would choose to take part, and that there are 3 things that are important to them in doing so. And that's trust, purpose, and possibility. And we want to make sure that those things are always considered in the research journey. Through the project, we developed 9 hallmarks of people-centered research, and I can come back to that. You're also doing a range of work to make sure that more people can take part in research and diversify the study participants. And Esther and Kathy talked about this already, and we're working closely with them. But there's 2 components in which we really want to facilitate that. One is about making sure that research is designed in a way so that right people are considered for the research that is likely to impact them. And the other aspect is making sure that those people can take part in the right way, in the right research, and have the right experience like we talked about. The other thing is through our statutory duty to promote research transparency, we also make sure that studies are registered and results published so people can find out about what research is happening and what it's found. We also support researchers to communicate the findings back to participants. So that relates to those 2 key questions that Kathy pointed out, one about people's experience in research and other thing about finding out about, what's happened about the research that they took part in and getting updates. So if we move to the next slide. So these are the hallmarks from that people-centered clinical research that I've just mentioned. And I think these are kind of resonates with the findings and also very much with the principles and values of PRESS, which I believe is in the next slide deck. So I'll stop there.
Thank you, Neho. Yeah, we're really supportive of the HRA's strategy and also their commitment to making sure that research transparency is promoted as one of the most important things that we work towards. And as you can see, the PRESS findings in the sense that people need to be able to contact their study teams, find out the results of PRESS, that chimes in with the ambitions that HRA also have. So we're going to be working really closely to make sure that we can make that happen. And as Neho alluded to, the hallmarks that HRA have developed, they chime in really well with the findings from this year's PRESS report, which concludes that PRESS has been delivered really well across all of the regions, and the key values and principles that we are able to pull from the data, we've been able to summarize into a set of values almost about how good research should look like, good research participation should feel like across all of our research delivery sites. So inclusive and accessible participation should be a key feature. We should have professional, friendly and empathetic staff. We already have this across all of our networks, but we really want to build upon that and just make sure that we, wherever possible, are going above and beyond to make sure that the participants are well taken care of and that their needs are catered for. Clear and comprehensive communication at all times, and well organised and efficient processes. So thinking about things from the user point of view, and when I say user, I mean like research participants. So what is it that they need? What journeys do they have to their research sites that might impact on their ability to take part in research? What are the external things that are also happening that might not fit into the processes that we've developed along the research journey? Comfortable and supportive environments. We're not able to make everything perfect, but where possible, we can make sure that people feel comfortable, that it's warm enough for them, that they are feeling well cared for, and that they have the practical and technical support available. So one of the key things for PRES is that we will always have a paper version for those people who need it. So although we are heavily promoting a digital journey because it helps us to visualize that data more effectively, we understand that we still need a paper PRES. We still need to make sure that we consider accessibility and inclusivity at all times when we're delivering PRES. So these are the key principles and values from this year's report, and it's something that we are going to take forward and working with all of our stakeholders to make sure that as a whole system, we're able to make sure that participants have the best experience possible and that they would take part in research again. So I am pleased to move on to the Q&A section. So we received a couple of questions through that we are happy to answer today. And as I mentioned before, we'll have an option on the last slide where people can submit questions to us. And there's an option there to download the full report and also get in contact with the team. So we really, really want to hear from everybody. Any questions that you would like to send us, we will answer all of them offline. So I'm just going to hand over to Heather, who is the person who has all of the questions to ask us.
I do indeed. Hello there. I'm Heather Slade. I am Strategic Partnerships Lead within Angela's team. Thank you ever so much to those of you who have submitted questions. We've had some really interesting questions sent to us. So we've picked out 4 to answer in our session today. The first question, which I think probably goes to Neho, first of all, how are we ensuring research participants receive the results of the research in line with the new HRA requirements? So over to you, Neho.
Yeah, okay, thank you. So I would say that we do this through a combination of approaches. So including system and process change, enhanced learning and guidance, and highlighting good and poor practice. It's fair to say that at the moment, sharing results with participants is a best practice expectations for all research from us. We have a guidance document called the UK Policy Framework for Health and Social Care Research, and there is a statement in that to that effect. But from April next year, for clinical trials of medicines or CTIMs, it will be for the first time a legal requirement to offer to share results with participants and other relevant persons where that is applicable. To help researchers and sponsors comply with that new requirement, we have produced detailed guidance which sets out how to share results, and that also complies with the UK GDPR, Data Protection Act, and confidentiality laws, all the other kind of relevant regulations. We also have on our website guidance giving practical sort of tips about how to effectively communicate study results to participants. So please do go and have a look at those. Recently, we held what's called a Research Transparency Make It Public webinar on sharing results with participants. And that was really aimed at, again, helping researchers and sponsors to comply with that new requirement and understand forthcoming changes in the regulations. That included a presentation from Angela here on the PRES survey, as well as principles and practice of doing this well, and a case study from a vaccine trial conducted by UCL. And a recording of that is available if you're interested in that. Finally, we're currently exploring chasing researchers who have not submitted a final report within the 12 months from when it's due from the end of the study. And that final report contains information about their research transparency and compliance, including whether they have shared the results with participants. And an initial pilot of looking at those finals reports found that chasing those reports actually enhances compliance on a number of areas. So that's something we're exploring. And in the spring next year, we intend to make public for the first time that the data we hold about whether sponsors have published those summary results and offer to share a lay summary results with participants. So again, publishing those information, we're hoping would drive, sort of good behaviour So those are the range of things that we're looking at the moment.
Brilliant, fantastic, Neha. Some brilliant steps forward from yourself and the NIHR there, and we'll share those links as well that you've mentioned in the follow-up to this webinar. So next question, I think perhaps Angie, if you take this one, and Esther, I think we'll have some really valuable feedback to this question as well. So as you mentioned around accessibility already, Angela, how do you make PRES accessible?
Thanks, Heather. As I say, we can only go into smaller detail on the webinar today, but there's a number of measures that we do with PRES to make sure that it's inclusive and accessible. So we offer an easy read version, and we also offer a larger print version for people with visual needs or access needs. So we've developed those co-creatively with patient groups, and they were tested and put into circulation a number of years ago now. So we also, in addition to the digital version and the paper version, have those two other options available. On the digital PRES dashboard system that we have developed, there is a Recite Me toolbar, which offers a number of accessibility options to people when completing PRES. So it has a translation function, it has an option for people with certain learning needs that they might be able to select. So we're constantly trying to think of new ways to make sure that whoever wants to take part in PRES is able to, but we definitely haven't covered everything as yet. So we're keen to hear from people about what they might need so that we can see if we can put that into place. Esther, I'm not sure if you have any follow-up comments there.
Yeah, just final comment. I think the PRES is built on collaboration and working with the feedback we receive from our participants. So, and you know, I get the sense, Angela, that you are fully committed to implementing changes when they are communicated. So I think accessibility is part and parcel of that. Whatever you need, I think communicating that through the PRES process is vital for making it more accessible in the future, and wrapping it into our implementation phases for improvement. I think that's the key point to get there, that whatever changes you want to see in terms of accessibility, communicate them, and we will work with you to make PRES better. Thank you.
Brilliant. Thank you, Esther. That's fantastic. The next question, perhaps again for Angela. My trust doesn't currently do PRES. How can I include this for our studies?
Thanks, Heather. So yeah, as we mentioned, PRES is ran over a number of different studies, but there's still a lot of improvement that we can make to make sure that every single trust or every single place where research has been delivered has an opportunity to deliver PRES. So I think if PRES isn't currently being delivered in your trust or your site, or the place where you are delivering research, I would encourage you to contact your regional research delivery network lead, and they will be able to discuss with you how you can start PRES in your region. They can share with you the different platforms that we have for PRES. So we'd be more than happy to share with the attendees of this webinar as well the contact details of your regional leads, so that if you want to do PRES in your area and it's not currently being done, that you have those contact points for you to explore whether it's possible or not.
That's great. Thanks ever so much, Angela. We'll share that information afterwards as well. The next question, I think, Kathy, if you take this one, and then perhaps Angela will have some additional points to add with her ambitious plans for spreading PRES throughout the lands. PRES is only in England. Are there any plans to expand to the rest of devolved nations? So over to you, Kathy.
Thank you. Yeah, so I can't answer that directly for PRES, but what I can do is state what the government's position is around research. So there's two key documents here, which is the 10-year health plan, the full title of which I've...
Well, Kathy, I think you've gone on to silent.
Apologies, my error there. Yeah, so there's two key documents here that I'd like to mention. So I'm not going to answer directly about PRES, but about the position that the government has around research in health and care settings. So two key documents. One is the 10-year health plan, which was published in the summer, and also the life sciences sector plan. And they are both very, very clear about the government's priorities around research, and that research should be business as usual activity in the NHS. That doesn't just apply in England, that is across 4 nations. That is a devolved nations issue also. We've been working very, very hard to increase the visibility of research at senior levels in the NHS. And I think sort of participant numbers is obviously a very easy thing to count, but participant experience is really, really important, and we would like to work on that visibility. But I will leave it to Angela to answer that question specifically about PRES.
Thanks, Kathy. And yeah, we fully recognise that that PRES and research that we currently are responsible for is delivered across England. We'd really like to hear from people taking part in research across all of the devolved nations. So we're going to be developing a 3-year PRES strategy, which will see us reaching out to our colleagues across the devolved nations and saying, can we bring PRES to you? Can we hear from your research participants too? And there might be some interesting data there for us to compare to really make a difference on where the gaps are and room for improvement.
Brilliant. Thanks ever so much, Angela. That concludes all our questions for the webinar today.
Thank you, Heather. And that nicely leads us on to the final slide. So I'd just like to thank everybody for joining us today. We've really, really appreciated being able to share this with you, and also to our stakeholders who've joined us for the conversation. We have a QR code here. We'd really love to hear your feedback about the webinar. If you have any questions, we really love to hear them, and we will answer all of them. So contact the team, the email address is there. And then also there's a QR code to request a copy of the full report. So we're going to leave this screen up just for another minute or so people have a chance to get their phones out or to note down the email address. We will share a recording of this with everybody, and we will also follow up with you by email just to make sure, you know, how did you find it? Let us know what you thought, and hopefully we can continue this with a series of public engagement webinars, introducing you to our team, what we do, and the services that we provide. So thank you so much to everybody for attending, and hopefully you've been able to kind of screenshot the QR codes. If not, drop us a line and we'll be more than happy to share them. So thank you, everybody.